We're going to interview Bill Emahiser here from Unison, and he's going to chat with us a little bit about how their services have changed, and they also do the crisis calls for Wood County folks. And so he's going to talk to us a little bit about any different protocols that they're taking right now, too. So what's going on in your world that's a little bit different now than it was even, just a short 2 weeks ago?
Yeah, so much has changed in just a very short amount of time. It's amazing. One thing that hasn't changed, though, is the delivery of services. One of the things that we really want to make sure that folks are aware of is at Unison, whatever way a person needs to access services, we are available for them. So we can provide services. We're trying to encourage people to use telehealth. We want to maintain safety for the public as well as for our staff. But if you are unable to and you need to come into the office, we are following all the CDC guidelines. You are still welcome to come into the office. We've had, so that's a big change. A lot of our clients are assuming that if it's telehealth and they can't do telehealth, that they can't come in. We've actually had a fair number of people say they were frightened that they might get arrested because they're supposed to be on, essentially quarantining to home. And we want to make sure that people know that if you need to come in for mental health services, these are essential services. The governor has outlined that pretty clearly. And so you still can come into the office. We're following all those CDC guidelines. We're actually even taking temperatures at the door. We do have personal protective equipment and face masks for clients if they are concerned that they can use. And so we just wanted folks to know that they can come in. And also, we are still providing community services. Some of our folks are so affected by their mental health issues that it makes it hard for them to get into the office on a usual, on a usual basis and under usual circumstances. With this unprecedented pandemic that we're experiencing right now, the level of stress on folks is really high and the fear is really high. And so we still do provide services out in the community. And so when it comes to our crisis line is truly essential, and we will continue to provide that service in the community. I wanted to give a shout out to all of our partners in Wood County, the police departments, the Wood County Hospital, the EMTs, the paramedics. Everyone we are all working together as a first response team. And I really want to give a shout out to those folks because they're doing a lot to help us and protect us as well as we go out and do assessments in the community. So we're really business as usual, but with more precautions for safety regarding the spread of the COVID-19 virus.
That's great. So is there anything that community members need to know or be aware of if they need to utilize the crisis services? Anything that they should, any questions that they should be prepared to answer, or really anything different?
So not a whole lot different. One of the things that they might find, though, is that there is a screening that we will screen and ask about physical symptoms, if they're showing signs, fever, if they have a cough, if they have been out of the country in the last 2 weeks, if they are already have some self-imposed or doctor-ordered quarantine. We would need to know that information, so we'll ask that up front, and that's more so that we can make sure that we're protecting our team as they go out and work with these folks.
So are you expecting an uptick in services then after, because we're all social distancing, and that's usually not great for folks that are dealing with mental illness anyway, but it's not awesome for the rest of our society too.
Right, and I'm going to steal something from NAMI, Wood County, in that it is about social distancing, not social isolation. And because we're really pushing the whole point of staying home and staying away from other people, that doesn't mean that you have to isolate completely. That doesn't mean that you can't go out for a walk. It doesn't mean that you can't interact with people online, that you can't do FaceTime, Skype like we're doing right now. And that you can still reach out to folks and talk to them and communicate. We want you to be connected to people. I am concerned, honestly, after that, the initial wave right now is about the physical health issue, right? Right now, we're trying to slow the spread of the COVID-19 virus. However, the longer this goes on, my I am anticipating, and I think others are anticipating, that there will be a spike because the stress is high. There's a lot of anxiety, and I am concerned about the social isolation piece. And so I would encourage people to try to, utilize some coping skills. I know NAMI, Wood County, has a ton of resources, so I'll do a plug there and would encourage you to look at those resources and strategies. And certainly, again, don't wait. If you are feeling if you're anxious, depressed, feeling isolated, feeling overwhelmed, and it's a pattern, and it's starting to impair your ability to function, please don't hesitate to reach out to us. You can call our crisis line at 419-502-4673. That's an option. That's the actual crisis line. So it's usually reserved for folks who are feeling so overwhelmed, or maybe they're feeling like hurting themselves or someone else. That would be that phone call. If you just simply need services, I would encourage you to call our usual number, our Bowling Green number, which is 419-352-4624. And don't wait. I would encourage you to be proactive. It's the uncertainty, right? The uncertainty of the situation. We don't know how long this is going to last and how things are going to pan out. And so I think during times of uncertainty, it's great to use your coping skills, but if that's not enough, please don't hesitate to give us a buzz so that we can help you.
Yeah, so we had talked about a little bit folks not social isolating, and I know that springtime is sometimes a difficult time for folks anyway because of, just coming out of our long winters that we have here in Ohio, and people are looking forward to being outside and stuff more. And so we've been trying to encourage people to, still get outside, just maintain that, that physical distance from others as much as possible. So do you ladies have any other questions for Bill?
I don't think so. I just think it's great to hear everything that y'all are doing and just still being available for the community.
Mm-hmm.
Absolutely, yeah, and our staff is really. I want to give a shout out to our staff too, because the vast majority of our staff are like, we're going to serve our clients until the government says we can't anymore. We are dedicated to trying to keep ourselves safe and not spread the virus, and in the same token, balance that with the safety of the community. And we know mental health issues. They can overwhelm you, and everyone needs help. And I would say, even if you're not experiencing, historically have a history of mental health issues, it doesn't mean that you can't reach out and get some assistance as well. I think we're all under a lot of stress, and so even though there might not have been a previous history of mental health issues, some of the stuff could boil up, and certainly we want you to encourage you to utilize the services that are available in the community.
No, I'm glad you brought that up. We're experiencing that with some of our folks too. Courtney, did you have something to ask?
No, I don't think so. I mean, it seemed like anything I was going to ask you pretty much covered, which is awesome. Yeah. I think it's great that it's a good service that is being utilized by many people. In my particular role, I do some things relating to Adamus in their marketing. So I've definitely been promoting that crisis line quite a bit. So I think it's a good service, and I'm sure it's going to be utilized quite a bit, which is good. I think people need the help in this special circumstance that we're facing. So I think it's wonderful that everyone's working together to meet the needs of people.
And we're already seeing an uptick in utilization of services and an uptick in specifically crisis-oriented calls. Mm-hmm. And so we suspect that will continue throughout the duration of this pandemic.
So I appreciate that you guys are still being committed to serving folks in the community and being there for folks. And yeah, you're right. We're all under a lot of stress. The folks working these different services and community members. So Bill, I really appreciate your time. Is there anything else you would like to talk about?
Not that I can think of, other than, I think this is a great time for us as a society, right? Just as a culture, to be kind to one another. This is a great time to reach out to people that you may not have spoken to in a while, chat with them, stay connected, and really, I take advantage of the time, right? So, I mean, with every downside, there's an optimistic side. There's an upside, and the upside might be, as while we're kind of stuck at home, right now is to be able to reconnect and connect with other people and really take appraisal of the things we're grateful for right now. And I think that helps to foster some optimism and make you a little bit more resilient maybe to anxiety and depression, and actually even might even improve your immune system a little bit to keep that optimism and that connection with other people.
Mm-hmm. Yeah, those are good points. So I'm hearing that crisis line's still there. Make sure you utilize that if that's something that folks need. I'm hearing that Unison services are still going as planned as folks need. And if people need to meet with their therapist in the office because telehealth is not an option for them, that you don't have to worry about being arrested or being out in the community because that is a necessary service.
Absolutely.
So I really appreciate your time. If there are no other questions from anybody else or nothing else to talk about, again, we appreciate your time, Bill. He is from Unison.
Thanks for having me. Appreciate it.
Thank you.
Thank you.